We're going to record this webinar, so if you all want to refer back to it, we'll be sending out the recording to you. Welcome everyone. Thank you for joining us this morning. My name is Jeannie Alter. I'm the Executive Director of the American School Health Association, and we're so thrilled to have you all here with us today. We wish that it were under better circumstances, but we're thankful that you're here with us today. So just want to share a little bit with you about the American School Health Association. We are a multidisciplinary professional association, and our mission is to transform all schools into places where every student learns and thrives. And we envision healthy students who learn and achieve in safe and healthy environments, nurtured by caring adults functioning within a coordinated school and community support system. And that element of coordination is really important to us and really important to the topic that we're talking about today. Just a little bit about our member benefits, one of which is free continuing education for webinars like this one today. We also have the Journal of School Health, which is our peer-reviewed indexed professional journal that you can get in print and online as a member. In addition to continuing education for this type of event, we also have free continuing education for our members for self-studies from our journal, our annual conference, which is in Albuquerque this year. And in addition, we have discounts on things such as select American Academy of Pediatrics publications, discount to the Sex Ed Network, and discounts to post on our Career Center. And just to let you know, we have a free area of our Career Center for those who are looking for an intern or for those who are looking for an internship. So please feel free to check that out. And last but not least, membership has its benefits in terms of the information and expertise that you get from our membership, and our access to the latest in school health through our annual conference, our bi-weekly newsletter, and I always invite you to stay in touch with us through social media. Just as a quick note, our conference is coming up in Albuquerque, September 30th through October 2nd. Registration will open May 1st, and if anyone's interested in sponsorship opportunities, just feel free to sing out. You can contact us through our website to learn more about that. So I want to send out a special thank you to Dr. Susan Kepler. She is our Emeritus Executive Director, and she, along with some funding provided by MedImmune, worked on a previous version of this webinar. And we want to thank her for her hard work with that, and it made it very easy to respond quickly in this situation where a quick response is really necessary. So I think some of the lessons that we learned from previous situations like H1N1 are very much applicable here, and we thank Susan Kepler for her work on a previous version of this. So I wanted to give her a quick shout out. Also, I wanted to let you know we're going to talk a lot today about the importance of partnerships, the importance of collaboration and coordination. And so we want to thank our partners, the Society of State Leaders of Health and Physical Education, for partnering on this webinar as well. We appreciate that they spread the word and let people know that we were going to be having this webinar, and we appreciate their partnership on this webinar and other things. So I just want to point out really quickly before we move on to our presenter for the day that we are kind of guided by the whole school, whole community, whole child, or the Wisc model. And that model is really important in the sense that it places the student in the middle, and it involves the components of the Wisc model that are tied back to a particular role within the school and the community. And the important aspect of it that I want to highlight today is just that aspect of coordination. When we have health issues that arrive, it is not simply the one a one person's role, right? It's not just the school nurse who needs to respond. It's not just the administrators that need to respond. It's a coordinated effort, and we all have a role to play. So I just wanted to kind of highlight the Wisc model and let you all know that this is kind of our guiding principle when it comes to situations like this. And again, coordinate. Coordinate is a verb, and it is to bring into a common action, movement, or condition. And that's what we're here to talk about today, is how we can best coordinate around the issue of the coronavirus. So I want to take a moment to introduce today's presenter. Mary Lay is with the Indiana University School of Public Health, Bloomington. She has over 30 years of experience in public health. She currently works for the Indiana Problem Gambling Awareness Program, or IPGAP, that has a great deal of experience in various areas of public health, and is an adjunct instructor for the School of Public Health. And we're so pleased to have her here today to talk to us a little bit about how schools can best coordinate and how we can do our job in preparing. So Mary, I'm going to turn it over to you in one moment as soon as I find your name here. There we go. All right, Mary, I'll turn it over to you.
All right, great, thank you. I want to thank Caitlin and Jeannie for this opportunity and for all the hard work they did for putting this together. This kind of came about for me because I'm actually teaching Intro to Public Health this semester, and happened to be showing the movie Contagion as this all came to light. So kind of put it into perspective with my students, and hope I can share that. My husband's a 4th grade school teacher, so I had a conversation with him and his team about the things that they're kind of concerned about and what they would like to know about. So I hope I incorporated things that people will be interested in. So let's get started. Okay, there we go. Okay, Jeannie, I am trying to control your screen. Hold on. There we go. All right, slow. We've got a lag here this morning, so sorry about that. Whenever we have a disease outbreak that occurs in communities or schools, we all have a role to play, whether an administrator, a teacher, a parent, or just a concerned community member. One of the things that we want to do is support our students. Students look to school teachers and others for guidance, and we must be able to help our students with their academic progress, along with helping them prevent disease and prevent being nervous about the situation. I can tell you from my own experience with kids of my own that when the bird flu came around and I had a child that only ate chicken, he was quite concerned about what his diet was going to be about. And he was in 4th grade at that time. So I think kids they hear a little bits about what's on TV and they're concerned about that. But in addition, we can help by minimizing that through good teaching practices and preparing students and parents for the possibility of even closing our schools during this time. Why does it move so slowly?
Mary, I can just change it for you if you want.
Just go ahead. Yeah, I know it's lagging too much on this end. Sorry about that.
No worries. You just say next slide when you're ready.
Okay, go next slide. Okay, so when we're looking at disease outbreaks in school, it's true. What we need to do is true for everything that we do when we work with students, and it's being prepared. We want to keep their lives as routine as possible with little disruptions, and we also want to not lose the momentum that we have for their learning opportunities. So during emergency situations such as pandemic disease outbreaks or just a regular epidemic of the stomach virus at your school, there are certain things we need to consider for alternative resources in addition to our current materials. So we want to be sure we plan, that we're flexible, that we demonstrate leadership, that we're stable, that we're sure about the decisions we're going to make, and that we have continuity, that we keep things as normal as we possibly can. There are a variety of resources online that teachers have currently used and can continue to use as they help to plan for a potential online or out-of-school learning environment. Next slide. Who should prepare for the outbreak? Administrators, nurses, custodians, the bus drivers, parents, classroom teachers, your local mental health providers, your local youth serving agencies. Everybody will have a role in this situation, just as they have a role whenever we're working on any activities within the school. Planning in advance will help us save money and alleviate concerns of parents and students about school and how they can continue to be successful. Next slide, please. Schools play a key role in everything that students are doing. Because parents and guardians are sometimes fearful about students contracting diseases in schools, we can help by providing families with practical prevention information. Schools can educate students and their families about ways to avoid contracting communicable diseases and spreading them. Teachers and others can model disease prevention techniques in the classroom and develop extended opportunities for continued learning during a major outbreak of disease. So finding ways to continue the learning, but also to demonstrate the things that we can do to help prevent the spread of any potential disease. Next slide. Disease outbreaks are not unique in schools and communities. Established partnerships will allow for rapid response to multiple issues. So having those partnerships in place beforehand are important, but we face those issues all the time, whether it be an issue of violence, a social media threat, whether it be a natural disaster from Katrina, or the snow that delays school in many parts of the country. Many things can put us at risk and can require us to be ready to respond. Next slide. So there are 5 basic steps for planning for disease outbreaks. The first one is prevention, which is an action that we put in place to avoid the issue or the illness that's presenting with us. Mitigation is where we are at currently in the United States, and what we're trying to do is reduce the impact of the disease. Preparedness is being ready with ways to address the issue. Response is putting our plans into place and being willing and ready to make any necessary changes as other circumstances come up. And then recovery. And the recovery is returning to normal with any needed support that might come up, and a return to normal day-to-day operations. So just like when we come back in this fall and after breaks, get everything back to normal and everybody back in their regular routine. Next slide, please. There's some basic things that we want to consider in the prevention side, and the first part of it is health education, and that is simply providing basic health information, basic definitions of what the diseases are, basic ways of ways things are transmitted, what you can do to help avoid getting sick, and what kinds of things can we do in our classroom to encourage wellness overall activities. Things like being aware of what's going on, making sure that kids know how to wash their hands properly, reminding them about how to wash their hands properly. So we're going to look at a few things at an influenza-like illness. COVID-19, which we're facing right now, is a very similar kind of illness, has a few differences than the normal seasonal flu, but things are pretty similar to each other. Next slide. Okay, health education begins with an understanding of the basic concepts such as communicable diseases are passed from person to person through direct and indirect contact. There are many strains of a virus that can cause flu-like symptoms. Unlike the common cold, influenza can cause severe illness and life-threatening complications among vulnerable individuals such as children and older adults, or individuals with compromised immune systems or neuromuscular diseases. Symptoms can last anywhere from 7 to 10 days. With seasonal flu, children might experience gastrointestinal issues as well, and they are not nearly as common in adults. In contrast to seasonal flu, a pandemic, widespread, or universal outbreak occurs when 3 conditions are met. A new virus emerges that is new to the population, the virus causes serious illness, and the virus spreads quickly and easily due to insufficient amounts of community immunity and a lack of a vaccine. With the use of proper prevention techniques, people can minimize the spread of these new viruses. Okay, next slide, please. Ways of preventing disease transmissions are not unique to the flu or coronavirus. First one is stay home if you're not feeling well. Cover your mouth when you cough or sneeze. Clean your hands. And if everyone did this, fewer people would get most respiratory illnesses. We do not need a new course for every event. If we have a foundation and a context in place already, we are ready to go. Right now, we'll look specifically at a few of the things about COVID-19, which is what people have all the questions about today. Next slide. Okay. COVID-19 is a respiratory illness. It spreads from person to person. So contact with any 6 feet of an infected person could potentially put you at risk. Respiratory droplets from coughing or sneezing that you inhale or come to contact on surfaces. More often, contact on surfaces. One of the reasons that this contact is important to remember is that unless you have a high-end mask, such as an N95, you really have not reduced your chances of transmission, because the mask, the normal mask that we all see that you pick up at the doctor's office when you go in and you're sick, you can still breathe in some of those, or you can get them on your hands and still touch your face and be exposed. Symptoms can appear anywhere from 2 to 14 days after contact with someone who has the virus. The symptoms to look out for is a fever, a dry cough, and shortness of breath. With flu, you see a lot of fatigue and runny noses and some related issues. But with COVID-19, we're really looking at a fever, a dry cough, and shortness of breath. It is very respiratory oriented. Wanted to give you an update on where we are. This is as of a half an hour ago. I checked numbers yesterday afternoon, and they've changed significantly overnight. Currently, we have 1,015,997 cases of COVID-19 worldwide. We've had 487 deaths, and we've had 64,385 people to report total recovery. In the United States, we're currently at 423 cases. We've had 19 deaths, and we are reporting active cases in 35 states currently. There are resources online where you can keep up with that. They also provide maybe some interesting opportunities to share things with your students. And when we send out some update, we can send out some resources to you at the end. A couple of them are even active sites where you can see where the diseases are, and they keep you up to date very quickly. And students may find that interesting, as well as parents and others that you work with. Next slide, please. COVID-19 is most contagious when you are symptomatic. It can spread, though, prior to being symptomatic, Initially, only those infected, the only ones who were infected lived or visited the Wuhan province in China. Currently, we are based on we have community spread, where people who have not visited hotspots such as Wuhan have developed the disease. We currently, we are located here in Indiana. Friday at noon, we had no cases, and we have now grown to 4 cases since then. All of our cases are currently related to 2 people who attended a conference in another state, but we have had spread to 2 students in schools in one of our counties in Indiana based on contact with these people. Next slide. Okay, so some of our basic techniques that we can't employ, particularly with COVID-19, what we need to remember is that encouraging immunizations whenever they're available, providing opportunities for people to be vaccinated annually for the flu. One of the reasons that you have to be vaccinated annually for the flu is every year there's a slight change in difference in the flus that are presented. And so we have a vaccine specific for the ones we think we will see. The Centers for Disease Control and Prevention recommends seasonal flu vaccines for all school-age children and youth, and for all those with long-term underlying illnesses. Likewise, school administrators, teachers, and others who have close contact with students should be immunized. A second method for immunizing the spread of respiratory infections is to practice good personal hygiene, like washing your hands frequently or using a hand sanitizer. This is particularly important before eating or touching the nose, eyes, or mouth. Students should learn to cough or sneeze into their elbow if a tissue is not available. Teachers can teach and model these practices. Another method of minimizing infection is to create school policies that encourage everyone who is ill, both students and school personnel, to stay home for the duration of the illness. Isolation is necessary to minimize the spread of diseases. Staying home allows a sick person to rest and get well and protect others. It's absolutely necessary for someone who might be ill in school. Social distancing themselves can help minimize the chances of others getting sick. Social distance involves minimizing close contact with others. So you may want to consider right now whether or not you have full school assemblies. Maybe you want to do them virtually through in-class audiovisual rather than have everybody come to the gym together and participate in an activity. With spring break coming up, there'll be probably lots of questions about these kinds of circumstances, and we want to be planning ahead for those even after spring breaks. Next slide. Things to remember: always turn away from others when sneezing, coughing, or blowing your nose. Cough, sneeze, or blow your nose into disposable tissues. Be sure that you dispose of the tissues appropriately and immediately. And cough or sneeze into your elbow or upper arm to avoid hand germ contact. After you sneeze, or cough into your hand and or your elbow, you should encourage the children and others to wash their hands. Children often need to not only be taught, but reminded of personal hygiene rules, indicating what to do when sneezing, coughing, or blowing. They may not always remember to do these things, and so it's important to keep reminding them. And it's also important for teachers, bus drivers, custodians, aides, and everyone to model these practices for their students to remind them of taking on these activities. Next slide, please. You should wash your hands regularly, including after sneezing, coughing, or blowing your nose. You should wash your hands for at least 20 seconds. So sing the ABC song, sing the alphabet songs that you know from your classrooms, singing happy birthday 2 times, but you want to make sure that everybody washes their hands. And you also want to be sure that everybody remembers that washing your hands does not just mean washing the palms of your hand, but washing the fronts and backs of your hands and getting your nails clean. It's also important to thoroughly dry your hands with a paper towel or an air dryer, and to also have alcohol sanitizer available if students are not able to wash their hands or you are not able to wash your hands. But it's important to do it for the full 20 seconds and to wash all portions of your hand and your wrists, getting into your wrist, not just stopping it kind of halfway down your hand, but making sure you get to your wrist. Okay, next slide. You want to avoid close contact with others who are ill or showing symptoms. You want to stay home from work or school and other public places. No sharing of utensils or foods with others, and avoid touching your mouth, nose, or eyes. If you want to practice a mindfulness activity, sit sometime at your desk, in your office, in school, and just pay attention to how often you touch your face. People touch their face several times during the day, and you may not even be aware of that going on for you. Next slide, please. The other reminder is to get plenty of sleep, exercise regularly, avoid stress, eat a well-balanced diet. So all of the things that we talk about all the time will help you in this or any disease outbreak situation. Next slide, please. Extensive cleaning of surfaces is important. Increased personal hygiene procedures is important. Strict adherence and clear policies on when you can come back to school after being sick. Make sure that the staff in your school has the appropriate resources to clean, that they can clean everything, they have enough resources to do that, and they can access more of them if it becomes necessary. And you or your students can use disinfectant wipes or soap and water to clean desks and tables on a daily basis if necessary. And students can help keep public areas clean of the classroom as well. So you can engage your students in helping keeping your classroom clean and help them to encourage each other to practice these safe methods that we've been talking about. Next slide, please. So what do we do? What are our follow-up procedures? So we want to know, keep everyone informed. One of our key things that we need to do is make sure everybody knows what's going on. People get nervous and fearful when they feel like they don't have all the information. So repeated communications are important. There's a variety of ways that people communicate with their students and their parents, whether it be the weekly folders that go home, school websites, phone, emails, social media such as Twitter or Facebook, TV and radio. I know my husband uses what is called Remind 101 to send out notices to families about things that are going on in the classroom to keep them reminded. And we also, and be sure that both students and parents are kept up to date and contacted. We can't always depend on the students to carry the information home, but we don't always want to depend on the parents to make sure that the students they're sharing the information back with the students. So it's our responsibility to be sure that everyone knows what is going on. Next slide, please. One of the keys to minimizing the overall effect is to have a plan in place before we need a plan in place. Be sure that you include administrators, faculty, and parents in these decision making, and also be supportive of teachers with adjusting their teaching styles and their evaluation strategies. One of the things that came to mind to me yesterday, because I'm in the classroom myself right now at the college level, is testing. Is that if we have gone to a virtual classroom, whether we want to continue to do our testing in the normal ways that we have. We may not want to give the traditional test. We may want to wait on our evaluations till after we come back to school, or do some sort of written rather than a multiple choice or other things like that. But we want to consider those circumstances, how we might address that prior to being in that situation. Teachers can use the telephone or email or web conferencing to maintain contact with their absent students, and schools can use any of these methods to promote non-classroom priorities and assistance, including setting up study groups or providing counseling or other services, mental health services that students may find they need. You want to keep the continuity of those services that you already are offering. Next slide. School closures. This is a big thing. What happens if we face that we need to close our schools? It needs to be a joint decision between schools, school corporations, and health officials. Schools have their priority, the health officials have their priority, and we need to find a way for everyone to come and work together. We need to plan in advance of the outbreak. We also need to balance the risk to students in the wider community. It may be determined that it's most beneficial to avoid contact in the community, but we also have to be aware that some of our students may be at home by themselves. If their parents are not able to be away from work, or they don't have alternative childcare situations, we could have students who find themselves home alone. It also interrupts those students who receive free and reduced lunch, and we want to be prepared for those circumstances. There has been discussions in several school corporations around the country about continuing being able to provide food services to those students who otherwise might not have access to balanced and sufficient food at home. And we want to keep everyone updated, parents and teachers. If we know that we're going to be closing our schools, if we can give a day's notice for that so everybody can be prepared for that, that is really important to do. Next slide. Preventing and minimizing our effects for education is establish what's essential. What are our essential learning opportunities? Reading, writing, and math are often the focuses in our elementary schools, so we want to continue to find ways to focus on those. And we also want to look for ways to do cross-topic activities with students. We may want to come up with some unique things they can do online. Teachers have a lot of resources that they already use to help engage and keep kids active during the day, and finding ways to incorporate those within some online lessons or at-home lessons can do that. But it also is important to remember that not everyone has the same level of internet access at home, so you need to have incorporated some ways for them to be able to do that. I know with my own kids in the wintertime, they usually have 2 to 3 days after they go back to school and they've had an e-learning day to complete the task. So if they haven't had access to all the resources that they needed while they were home, they still had an opportunity to be successful and complete the tasks. Next slide, please. And then when we're done, the future, we may need to consider having bereavement counseling and mental health counseling available at the school. There may be deaths associated with this outbreak or other disease outbreaks. It may not necessarily be the students in your school, but it could be people that they are close to, or people in their family, or people within the school family that might be involved. You also want to be able to be supportive for any missed instructional time. Those of us who live in the Midwest, we've had a relatively mild winter, but we have missed a few days of school already. So we're already into in Indiana, we have a school minimum number of school days. And so we have some of those built in, and we've used up several of those already. Be aware of contract and union issues for school closures and employee illness. Need for continuing support of school immunization, school clinics, and being aware of who might be at risk for infections because they're not able to get immunization. As a reminder, we don't have a vaccine yet for COVID-19. We probably will not have one till about this time next year. It'll take about a year to 18 months for one to be developed and readily available. And we need to prepare for the next event. We need to review what we should do to go through and what we have done and determine how could we have done this better, what went well, what we think we could do better next time, and brainstorm ideas on how to improve those circumstances. Next slide. Disease outbreaks in schools, again, we want to plan, we want to be flexible, we want to provide leadership to our schools, to our students and parents and other teachers, and we want to be stable. We want to keep things as close to normal as possible, and we want to have continuity. We want to keep things consistent. We want to think through our decisions before we put them in place. Be prepared to make changes, but try to make as few changes as possible, because keeping things kind of on an even keel and not panicking anybody because we have to make major changes very quickly can go a long way in keeping everyone safe and feeling well. Next slide. Keys to successful planning, you want to ask yourself several questions. No two disasters or disease outbreaks are exactly the same, so no one can actually determine the extent of chaos and disruption that a pandemic outbreak might cause. Planning for a worst-case scenario should cover most lesser events that we face. A major pandemic will affect not only schools, but also hospitals, businesses, neighborhoods, and whole communities. Schools can contribute leadership, stability, and continuity for helping prevent and curtail widespread disease outbreaks. Schools that develop systems to ensure that students and their families stay connected to the school and that students' education is minimally disrupted help to minimize problems resulting from major disease outbreak. It's all up us to plan for the future. So you just questions you want to ask yourself. How will I communicate? How will I keep my families and students informed? Do we have the appropriate equipment and other resources that are necessary? And what additional training or expertise will we need to put in place? So this is kind of the overview that we wanted to share with you today. And now we'll try and answer any questions that you have. Okay, one of the questions, one of the questions submitted to us is, a student presents to a public school health official with a fever of 101.4 and a persistent cough. How should we best proceed? You should take your normal actions that you normally would when a student has a fever. In Washington State, their schools have faced this sooner than some of the other states have. So on the next slide, you'll see that they've published an FAQ about what to do. Next slide, Jeannie. There are things that students and volunteers who are ill with a fever, cough, or breathing and have traveled to China in the last 14 days, or ill with a fever or difficulty breathing and have been identified by public health officials as being close to someone, you should isolate them. They should go home and keep themselves at home until they are better. If someone has come in contact with someone and isn't exempted that has COVID-19, but has not yet started to exhibit symptoms, they should self-quarantine themselves at home for 14 days to ensure that they don't infect anyone else. Every health department has different, every state has their own health departments. County health departments are dealing with them differently. Right now, we don't kind of have a 100% uniform addressing them. But the main things are to be aware of the symptoms of a dry cough, of shortness of breath, and a fever, and to take action. You shouldn't go directly to the hospital. The recommendations in most places is to contact your local health department, and they will address how you should do that. So in your schools, you should have the information available that if a student presents themselves with a fever and other concerns, you can contact the health department to see how you want to proceed with that. And additionally calling their parents, like your normal activities, but also check with the health department and they can give you the best advice for how to proceed. What else do we have here, Jeannie? These are our government, the CDC has a lot of facts about this. Those are available. Most health departments have facts like that. Having those available to everyone in your schools so they know what they're looking for is helpful. Next slide. And then these are some resources that we have available. Jeannie, you might want to speak to these. You included some of these here about where you can get more information.
Yeah, it was helpful. The Society provided some really great resources in their promotional email. So I wanted to make sure that that was available here to you all. This is for COVID-19 in particular, and then these are resources related to preparedness. So we'll make these slides available as well afterward. We got a few questions ahead of time and some questions as we've been moving forward. I appreciate, Mary, you sharing your expertise with us. And as we all know, this is a changing situation. As you mentioned, the numbers change hourly, and even some of the recommendations are changing very quickly. So please don't feel like, Mary, you could take a pass on some of these questions if you don't know the answers. What we will do, though, our promise to you is that we will take all of the questions that we can't answer or that we don't get to, and we will try to point you at least in the right direction. And send that out at the end of the webinar. Give us a little bit of time to do that. So let's go through some questions while we have some more time here. And Mary, like I said, you can take a pass and we'll look up
what we can do here.
Yeah, we'll see what we can do. Okay, so first, there's been some discussion about masks. Can you clarify that it's surgical masks, which can be placed on students, not N95s? What do you know about the masks, Mary?
The primary things that are out there about the masks now, if someone is ill, the mask is helpful to have that for them spreading COVID or any illness, but is not shown to really be effective for preventing you from being exposed. I would definitely recommend that if you have concerns or issues about that you look at the CDC's website. They have the cdc.gov. They have a long list of things to consider about masks, and they also have a special site just for schools.
Great. Awesome. Thank you. I also wanted to, Caitlin, if you could, I want to prep you to unmute Claire Barnett. I know that she had emailed some information, and I wanted to give her an opportunity to comment. But before we do that, just this one question. What about for specialty subjects like music and physical education, where multiple numbers of students share equipment and instruments? And Claire might have a comment on that as well, but I wanted to give Mary an opportunity.
Yeah, I'd be interested to see what Claire says. I actually have addressed that with my own kids. I'll address what my kids are doing. Both of my kids are in their college bands, and they do share instruments, and they have stopped sharing instruments. They were sharing instruments with their own mouthpiece, and they have simply stopped doing that for this period of time. They determined it was just not a good way, could not get them as clean as they thought they might need to, and so they have stopped any instrument sharing in their band. So I would say that unless everybody has their own recorder, you probably want to avoid sharing those sorts of things. You may be able to, in PE, do some cleaning, some disinfecting, but I think with musical instruments where you breathe into them and leave saliva behind, that's probably not a good idea. That's my personal parental feeling at this point.
So from a teacher's perspective, there may need to be some decisions or conversations about what maybe we could push down the road a little bit, like wind instruments we'll get to, and let's switch to something that's more easily cleaned between uses. Claire, I wanted to invite you to comment. Claire is from Healthy Schools Network. She's the executive director and founder, and I wanted to give you a chance to make a comment if you'd like.
Great, thank you. Can you hear me, Jeannie?
Yes.
Oh, great. So thank you very much. I mean, this is a great review of things that affect personal behavior and school decision making. But I want to bring one other issue to the fore, which is there are, beyond just personal behaviors, there are school institutional responsibilities in maintaining a healthy and safe workplace, not just for personnel, but also a place for children. And that has to do, in terms of prevention, that's, do you have good air quality? Do you have good ventilation? That's really important if you've got a respiratory challenge. But the other thing is how you clean and maintain school buildings. And I've found when we've looked at how states are commenting about this, whether the state of Washington, by the way, has fabulous advice on cleaning and maintaining schools. So does New York, so do a couple of other states. But I want to really bring that to the fore and remind people in the school health field that cleaning and disinfection are two separate processes. So if you're going to disinfect a hard surface, it has to be clean first. And that's on the back of the Lysol wipes. It's also on the back of the Clorox wipes. So you really need to read those directions very specifically. So you can use general all-purpose cleaning products or green, certified green cleaning products. They both do the same thing. And so you clean the surface first, then you can apply a disinfectant, and then let it sit for a dwell time, and then let it dry. So that's really the process that needs to take place, and it can take place on all hard surfaces. The other thing to remind people about, when you read the directions on the back of the disinfecting wipes, they are not for use by children. Children are not supposed to handle them. That's because disinfectants are registered pesticides. And if you look at the back of those containers of any of the wipes or any of the disinfecting products, it will tell you on the product label which microbials it is registered to kill. So disinfectants kill living organisms, and they're certified to do that by EPA. So right now, our understanding is EPA has published a terrific list of disinfectants that will address the coronavirus generally. There is currently no guarantee, to my knowledge, not looking at the EPA web, that there's some of the emerging disinfectant products actually will deal with COVID-19. So it's a slight, it's a more advanced form, but certainly it's part of the coronavirus family. So do check out the EPA website. We've put some guidance up on Facebook, on our Facebook for Healthy Schools Network, about the coronavirus and what to do in terms of cleaning and maintenance. And I was glad to see you citing the Washington State Department of Health, because they've really done a terrific job. I would also call out the fact that CDC, in its guidance for schools, mentions the fact that kids should use quote unquote wipes to wipe down hard surfaces. And we've asked them to clarify that simply because kids should not be handling disinfectant wipes, number one. So what is it you want them to wipe hard surfaces with? Thanks. Thank you very much.
Thank you, Claire. I really appreciate your perspective, because I think this is bringing about a lot of really important issues around the school environment and what kinds of chemicals we're bringing into our environment. Very important. So thank you so much.
I just wanted to share something. One of our participants, Cheryl, I want to thank you. I used the CDC website to update my numbers this morning. She updated the numbers from Johns Hopkins, and you will see that we actually are at 761 cases, 27 deaths, and 8 recovered. My numbers are from 5 o'clock yesterday afternoon. So that's how quickly this is changing. One of the questions that a couple of different people have asked about why our numbers are lagging behind in the United States. One of the issues that we have in the US has been actually having the availability of the testing kits. That has been a slow process in getting ramped up for us. Also, the CDC has been in the process of changing their criteria for testing. Initially, they had a much more stringent policy for testing. They have modified those. Currently, we still have a situation where the test kits still go to Atlanta to be, after someone's been tested, they can be potentially identified, and then it's confirmed at the CDC in Atlanta. At their facilities, they are in process of making some modifications in those procedures. So with that, as a public health person, I'm going to say, don't be surprised in a few days if we see a big jump in numbers that may be more a result of clarifying the testing and identification procedures and not a major rapid increase in infections. We may have more people infected right now than we're actually aware of. So when you see numbers jump, it's good to read the adjoining articles or other information to see why that might be, because that can cause some definite feelings of unwell among us and a little nervousness. So just want to share that with you.
I think that's a great point. I was actually talking with my mother, who's retired and has a lot of time to watch television, and there's a lot of anxiety and maybe even panic from folks as they see those numbers kind of uptick. But like you said, it's almost, and this is how I tried to explain it to her, when the sheriff's department gets a grant to do Operation Pullover, all of a sudden speeding increases because now they're able to enforce it better. And it's a similar situation where we have people who are infected and who are walking about and they just don't know they're infected. Once we start changing the criteria for testing, then we start to see, we get positive confirmation about that. So I think that's really important to kind of keep in mind and sort of help quell the anxiety.
I see a really important question on here from Linda, and that is, we are starting spring break this week. I am concerned when we return, since the incubation period can be up to 14 days, what should we have in place for the return from break? That's a really big question, and I'm not sure we all know the answer to that question, except that taking in consideration some of these planning things that we've discussed, being sure you have in place criteria and enforce the criteria for when anybody is sick, no matter what situation we're facing, about coming to school. Enforce if you've had a fever, don't come to school. If you're feeling ill, don't come to school. And that's true for both the students and the teachers and others working in school. I know we all want to power through sometimes, but I think it's important in this circumstance not to do that, because we just don't have enough information yet about what's going on and how quickly and how easily this may spread in the next few weeks.
And again, I think that question really speaks to the importance of coordination, because this is a decision that needs to be made up the chain about, I know some schools, that we have one in Indiana here right now, a school corporation that is closing down for 4 weeks. And they, that was a discussion that was had through all the levels, right? It was a discussion up to the superintendent, all the way down to, the custodians about what they can handle. and what the right answer is. So that's where it's really important to kind of have those discussions ahead of time with everybody who needs to be involved. And if you have a school health council or school wellness council, it's a great opportunity to get some input from kind of where food service is feeling, what they're feeling, and where their mind is at, how parents are feeling, how PE, how after school activities, youth serving agencies, that's a really great place to kind of take a temperature, no pun intended, of how folks are feeling and what they are willing and capable to do to help with social distancing, with isolation, and with those hygiene pieces as well.
I noticed a question on here about school cafeterias, salad bars, and water fountains. I think that's one of those circumstances that you probably should have a policy or have a discussion within your school about what you would do no matter what infectious situation we're facing. Potentially maybe having the salad bars, you have to decide if that's what you want to continue to do. Maybe allowing students to have water bottles or refillable water bottles and not having people drink out of the drinking fountains. Those are things you kind of need to decide at your school level. But I would also include your school nurse in these situations, but also contact your local health department and see what their recommendations are for you, because it's a time to collaborate with those who are the experts in the field in your community.
Mm-hmm. I think too, we want to keep an eye out for those students who maybe have anxiety that manifests itself in terms of being fearful of getting sick or of germs or things like that. This can be a particularly triggering time for them, and I think we just need to keep our spidey senses around those students and providing them additional support, reassuring them that this is, that the adults around them are taking precautions, that they can do those very basic things, and that we will be okay. So please keep an eye out for those students as well who might be struggling a bit more right now.
There's a question about hand sanitizers. I'm going to say I don't know how they're addressing the situation with schools and others due to the limited number of hand sanitizers available. I would recommend you contact your local health department and probably check what your state health department is saying.
I have an almost full bottle. I'll sell it to you for now. I'm teasing.
On that note, this is something Jeannie said that on my house, is that I have a 94-year-old father-in-law, and so he's in a high-risk category. And one of the things that we had doing, because we have hand sanitizer, we gave him some, is that he uses it every time, all the time. Even he washes his hands and then he uses the hand sanitizer. So we've been encouraging to save his hand sanitizer for the opportunities and do an extra wash of his hands, because it is hard for everyone to get right now. Mm-hmm. So we want to maximize that. Now, what I can say from most classrooms that I've been in, most of them probably have 3 or 4 big bottles of it sitting around the room, because it's a pretty common thing we have in the school. But as this question said, a lot of kids don't have that when they go home. Mm-hmm. So you want to be sure that they have hand washing skills when they do go home.
Great. And Claire posed a question about any examples about how to help homeless children who will not have internet access or school meals. I think the food insecurity piece is a really important thing to keep in mind. I know our school corporation has a Backpack Buddies program where we send food home with children who are experiencing food insecurity and maybe housing as well. So I think that's something, again, to be planful about ahead of time, especially, and I know a lot of schools already think about this when it comes to breaks and being able to send home easily prepared, maybe raisins, applesauce, squeezy packets. I'm making a motion for those of you who are on the phone. Oatmeal, all you have to do is kind of add hot water, those kinds of things that are really easy for a child of any age to prepare on their own. So that's something that I think we need to be planful about. Again, this is something that we need to plan for, whether there's coronavirus or flu. when breaks are occurring. And I know we're running up on spring break. Our spring break is next week, so we're all thinking about that. So great point. And reaching out to your food bank might be a really great opportunity to partner with them.
Yeah, and if you're looking for some ideas on what you can do with that, I don't normally say contact Dr. Google for everything, but look around at what other school corporations are doing around the country, because there's some different things, including I saw a school, and I can't remember, I think it's in New Jersey, I don't remember for sure, that's going to do drive up, that you just drive up in your car and you can pick up a sack lunch, so that you're not interacting with a lot of other people. So look around and get ideas from others. I think this is the time for us to be creative and find new ways to do things we've been doing forever.
Mm-hmm. And if we have a situation where someone suspects that maybe they have COVID, that, for example, I live in a college town. There are, 3 primary employers, well, maybe 4. A lot of the Indiana University employees have the same insurance, and there are options for telehealth, which might be something that's really important to point out to folks, to, instead of running to your doctor's office and exposing everyone there, that, utilizing those steps first to identify whether or not coming in is important or not. Of course, if you have shortness of breath, please go see someone. But I think that might be helpful as well too, to point out those options that we don't oftentimes take advantage of, maybe the nurse line, those kinds of things. Any other questions, Mary, that you want to try to tackle in the next 3 minutes? But again, we'll circle back and try to get to these. Oops, excuse me.
Okay. There's another global tracker. Yeah, the global trackers are really interesting. I would suggest everybody check those out. They kind of give you a good feeling on the scope of the issue.
Yeah.
I think a couple more out there. Spring breaks are coming up. We kind of addressed that. I think we've kind of hit the highlights.
So we'll take all the questions in the chat, and we'll try to address them. We'll try to provide you with some
Q&A on those. So
links and things like that. So please know that we're not ignoring your questions, but we will do our best. And we want to be respectful of your time as well. I just want to let you all know about some upcoming webinars that we have. We have quite a few coming up, so please spread the word and join us for those that are of interest to you. Just as a reminder, this webinar is eligible for 1 continuing education hour for entry level and advanced level check through NCHEC, MCHES, ABC, XYZ, and also nursing CEs as well. And if you have another credentialing body that you want to get credit for, we also can get you a participation certificate that you can provide to that certifying body. For those of you that are members, that is completely free for you. There is a charge for those of you who are not members. And if you would like to obtain CEs, just Caitlin will put in the chat box the webinar evaluation, and that's how you can obtain those CEs. Once again, please remember, we'll be in Albuquerque. That's the plan. September 30th through October 2nd. Always feel free to sing out, give us a call, send us an email. Always feel free to reach out. I want to thank you again, Mary, for your lending your expertise to us today. Really appreciate it. Claire, thank you for your comments as well. And we want to thank the Society for their partnership as well. And we wish you all a very helpful day. And thank you so much for joining us. Have a great one, guys.
Thank you.